Hi, folks. My name's Ejan, and I'm a consultant psychiatrist in an early intervention service in the NHS in Peterborough, in the UK. And this is part one of a 5-part video series about what I try and do in the psychiatry clinic. So part one is about people's stories and modeling minds. So what I do when I see people in clinic is to try and get a sense of where they are now in their lives and where they used to be. And really, what I find most useful to do is to help people walk me through the journey from where they used to be to where they are at the moment. And if you can help people walk you through the journey that they've been through, you can usually get most of the information that you need to try and understand what they've been going through and where they've got to in their lives. Now, by the point that most people get to see me as a consultant in the NHS, they're either very clearly in what we'd call illness territory, or there's a good suspicion that things have got so bad that they're in the territory of what would qualify as a mental illness. And while you can sort of try and explore whether people are in this space, what is always useful to do is always get a sense of where they've come from to get to this point. You want to get some sense of who they were before things started to change for them. And often the way I do this is to ask people, when did things start to change and how did they start to change, and just see if they can take me through the steps that they've been through till the point that they've got to see me. Now, what I'm trying to do through this process is essentially figure out what illness or difficulty does this person have? Who is the person who has this illness or difficulty? And what has it been like for this person to go through what they have experienced? And what you're trying to do alongside that is to care for them, to create safety for them, to build a relationship with them, and often bear witness to what they have been through. Now, in doing this, there's a particular task that I think is very important. And I think of this as the task of modeling minds. And this is essentially trying to understand other minds that are not like yours. So we classically think of the empathy question as, how would I feel if I was in this person's shoes? And this relies on two major assumptions. The first is that you have a reasonable understanding of what it's like to be in that person's shoes. And the second is that your mind is sufficiently like their mind so that you can come to some approximation of what it might feel like to be in their shoes. But really what you want to do is get a sense of, how does this person feel in their shoes, right? And for this, you need to have some ways of trying to think about other minds that are not like yours. You're not going to be able to do this perfectly, but any attempt that you can make to try and get a little closer to the mind of the person that you're seeing or working with will help. And you want to do this while you're trying to figure out these questions. What illness or difficulty do they have? Who is the person who has this? And what's it been like for this person to go through what they have experienced? Okay. Now, in the next part, I'm going to talk about the process of clinical evaluation.